As COVID-19 coronavirus infection continues to spread around the country, data has shown that poverty, lack of health insurance, socioeconomic vulnerability, and housing insecurity may all contribute to higher risk of contracting COVID-19 and having severe outcomes. In the United States, approximately 12% of people are experiencing poverty, 8.5% do not have health insurance, 10 to 15% experience housing insecurity, and 11% are unemployed. These issues are related. As the pandemic affects businesses and employment, the cycle of poverty may be reinforced by the progression of the pandemic and lead to further unemployment, poverty, and related issues like insurance and housing. To start visualizing some of this data, click on the tab Map Your State. By selecting a state and next selecting deaths or cases under COVID outcomes, and finally selecting percent poverty or another measure in county population characteristics, you can map these relationships side by side in a state of your choosing. As we see here, cases per 100,000 in Arizona track with poverty. We also see this in Alabama and Georgia. In Connecticut, the case rate tracks with the percent of uninsured residents. We also see this relationship in Washington and Delaware. The composite index of socioeconomic vulnerability, which takes into account poverty, unemployment, per capita income, and lacking a high school diploma, tracks with cases per 100,000 in Arizona, Georgia, and New Mexico. Finally, let's take a look at issues of housing and transportation, a composite measurement that takes into account dense living structures, mobile homes, households with no vehicle available, and institutionalized group living. In Mississippi, the death rate tracks with housing and transportation vulnerability. Take a look for yourself at these maps and see the relationships you can visualize between COVID-19 and county characteristics related to poverty.